Graphigara Hill University, Dehradun, School of Pharmacy presents this session for medicinal chemistry. Today we will continue with the drug for parasympathetic nervous system, part 6. I am Associate Professor Dr. Ahmed Nawaz Khan from School of Pharmacy. In the previous class, part 5th, we have discussed the cholinomimetics alkaloids like muscarine, pilocarpine, aceclidine, and the pilocarpine we discussed in detail the pilocarpine, which is used in the treatment of the glaucoma. In the indirect acting cholinomimetics, there are of two types, reversible and irreversible, and chemically classification they are carbamates and organophosphates. And the example of the reversible is first the physostigmine, in which we have studied that it is used in the glaucoma, while the neostigmine is used in the myasthenia gravis, and how it is synthesized chemically. Now, before move on to the hydrophonium chloride, just for a revision, we should remind that the indirect acting cholinesterase inhibitor or acetylcholinesterase inhibitors, they are of two types, organophosphate and the carbamates. Organophosphate, they are long acting inhibitors of the acetylcholinesterase and they are irreversible like parathion, malathion, etc. We will discuss them in the later stage. And we are discussing now the carbamates, which are intermediate to long acting, and like neostigmine, physostigmine, pyridostigmine, and they are reversible inhibitors. But this hydrophonium chloride is a short acting. Organophosphate, they are long acting, carbamates, they are intermediate to long acting, and hydrophonium is a short acting inhibitor. Now, how it is synthesized? This is synthesized from M-dimethylamminophenol. Basically, this compound belongs to a class of organic compound known as aniline and substituted aniline, and these are the organic compound containing an aminobenzene moiety. This hydrophonium is available as a hydrophonium chloride salt. It is water soluble and white crystalline powder. So now, how this synthesis is taking place from M-dimethylamminophenol? This M-dimethylamminophenol is treated with ethyl iodide in an organic solvent to get dimethyl ethyl M hydroxyphenyl ammonium iodide, this one, which on treatment with the moist silver oxide followed by the addition of hydrochloric acid forms the hydrophonium chloride. Now, it has a rapid onset of action and it is used in the investigation of the myasthenia gravis. Now, next is ambinonium chloride. This is the IUPAC name of ambinonium chloride, and this compound belongs to the alpha amino acid amides class. So, these are amide derivative of alpha amino acids. This ambinonium, it occurs as a ambinonium chloride and it is a white, odorless and water soluble solid. This ambinonium chloride, it works similar as a pyridostigmine and neostigmine for the treatment of muscle weakness and fatigue in the people with myasthenia gravis. So, but ambinonium is used less commonly than the neostigmine or pyridostigmine, but may be preferred in patient with hypersensitive to bromide ion, because if you remember, the pyridostigmine comes in the form of pyridostigmine bromide. So, if the patient has the hypersensitivity to bromide, so then the ambinonium is prescribed. But the overdose of ambinonium causes the muscle twitching, weakness and paralysis of the voluntary muscles, including tongue, shoulder, neck and arms, and also there is an increase in the blood pressure. Now, tecrine hydrochloride. This is the IUPAC name of the tecrine hydrochloride, and this compound belongs to a class of acridines. Acridine is the compound which is a moiety basically, which is a linear tricyclic heterocycle which consists of two benzene rings, and two cycles are joined by a pyridine ring. It is a central active cholinesterase inhibitor that has been used to counter the effect of muscle relaxant and as a respiratory stimulant in the treatment of Alzheimer's disease and other central nervous disorders. But now this tecrine has been discontinued in the US because due to its narrow therapeutic index and some frequent cases of severe hepatotoxicity and gastrointestinal toxicities. The tecrine is rapidly absorbed, but absolute viability of the tecrine is approximately 17% only. The overall mechanism of tecrine is not fully known, but it is suggested that the drug is an anticholinesterase agent which reasonably bind with the inactivate the cholinesterase as the previous drugs, and the overdosage of the cholinesterase inhibitor can cause the cholinergic crisis characterized by severe nausea, vomiting, salivation, sweating and bradycardia. Before we end this session, if you remember, the major therapeutic use of the cholinomimetics are to treat the disease of just like glaucoma, that means disease of eye, the disease of gastrointestinal and urinary tract, which is also known as post-operative atony or some neurogenic bladders, and also to treat the neuromuscular junction, just like problem like myasthenia gravis or neuromuscular paralysis, etc. And nowadays these drugs, they are also used in the patient with Alzheimer or the Parkinson disease and schizophrenia patients.